All right, nurses, let's address the new tablet system. I know there's been a learning curve. The primary goal of this system is to streamline patient data access and improve efficiency. You can input vital signs, medication administration, and progress notes directly.
What about patient allergies? How do we ensure they're clearly visible?
Excellent question. The allergy information is displayed prominently in red at the top of the patient profile. Also, there's a function to flag severe allergies for quick reference during medication administration.
I'm worried about battery life. What if the tablet dies during a code blue?
We anticipated that. The tablets have extended battery life and can be quickly swapped. In Code Blue, we prioritize paper charts as a backup, but the tablet data will be synced once the emergency is over.
Will there be training for everyone? I'm still struggling with the medication module.
Absolutely. We're rolling out mandatory training sessions next week. There will also be online tutorials and a dedicated help desk. Remember, this system is a tool to enhance patient care, not a hindrance. Let's focus on adapting and utilizing its full potential.
MIHIRAA, when you're preparing for surgery, we need to make sure everything is just right for you. To do this, we conduct what's called a preoperative assessment. Think of it as a thorough checkup to ensure you're as fit and ready as possible for your procedure. This assessment typically involves a few important steps. For example, we'll usually ask you to have some blood and urine tests done. These are very common and help us get a good picture of your general health and how your body is functioning. Sometimes, depending on your health and the type of surgery, we might also need to do an ECG, which is a simple and quick test that checks your heart's rhythm, or perhaps a chest X-ray to get a clear image of your lungs. These tests are all about gathering vital information to help us plan the safest and most effective care for you. Beyond these tests, you'll also have important consultations with our medical team. You'll meet with the anesthetist, who is the doctor specializing in pain relief and anesthesia during your surgery. They will discuss the best type of anesthesia for you and answer any questions you might have about it. You'll also have a chance to review your medical history with the surgeon. This is a great opportunity for them to understand your past health in detail and for you to ask any remaining questions directly. All of these steps are designed to make sure we have a complete understanding of your health and that you feel comfortable and informed every step of the way.